So the question is, inpatient or outpatient physical therapy? Before we start, I have to recognize my own biases, because everything I'm going to talk about is based off my own past experiences. So there may be a lot of subjectivity here, but regardless, I hope that this discussion is going to be beneficial to those who are choosing between inpatient and outpatient physical therapy. First, I think we need to define what is inpatient PT and what is outpatient PT. So inpatient physical therapy is often also known as acute care physical therapy. But first and foremost, something happened that brought the patient into the hospital, whether it be the flu, infection, cardiac issues, any type of post-op, you name it, anything you can imagine. So the patient is sick enough that they need hospital care. Versus on the other hand, you have outpatient physical therapy. So in outpatient PT, patients are walking into your clinic. So these patients are healthy enough to physically come to you. And the type of injuries you tend to see here are ankle sprains, different muscle strains, chronic pain, anyone who enjoys an active lifestyle and wants to get back to doing something they enjoy, total hips, total knees. So fundamentally, there's a big difference between the goal of inpatient PT and outpatient PT. So with inpatient PT, the biggest goal is to get the patient out of the hospital. You're there to help with discharge planning, so to see if this patient is safe to go home or if they need more additional services, like to go to another rehab facility before going home. For example, if someone lives alone and has a flight of stairs to get into their house, but they're so sick that they can't get up a flight of stairs and they don't have anyone who can help them. So in that case, it's up to you to make that judgment and assess if this person is safe to go home. So in that case, probably this person is not safe to go home. So you'd have to explain to the patient and make your recommendation to the rest of the medical team. For outpatient PT, you're there to help patients get back into whatever they want to do. They may be dealing with back pain or shoulder pain, and you're really there to help improve their quality of life. So I'm going to talk a little bit about the pros and cons of each setting. Inpatient physical therapy, the pros are there's documentation time built into your schedule. And compared to outpatient PT, you're typically not seeing that many patients in a day. Sometimes you're only seeing 6 to 8 patients a day. The setting in general is more medical in nature, so you're working with doctors, social workers, nurses, and the whole medical team to figure out what the best plan is for patients. And you really have to know your pathology and different types of precautions. When is it okay to see a patient? When are they too sick to be seen by PT? So there are a lot of perks that comes with working in a big hospital system. So the hospital is probably well staffed, so there's more flexibility to take time off. There's a higher chance of getting a consistent schedule that you want, so from like 8 to 4 or 9 to 5. And also by working in a hospital, you'll probably have really good insurance and healthcare benefits. The cons of inpatient PT. So because the patients inside hospitals are so sick, you're almost limited to doing low-level exercises. Sometimes just getting out of the bed is a huge win. Sometimes standing them up is all they can handle because their heart rate is going crazy. So a lot of the times you're focusing on gait training, so teaching someone how to use a cane or making sure someone can use a rolling walker safely and walk 100 feet. So everything you do with the patient is pretty low level and similar across the board, which can get a little bit monotonous. Documentation is a lot more extensive. So another con is that patients come in and out of the hospitals really fast. Sometimes they're there for 3 days, sometimes they're there for a week, and then they're gone. So you don't really get to see long-term progression of how they do a month or 2 months after their stay in the hospital. So this can be a pro or a con depending on what type of patients you like to work with. So I've had coworkers telling me that that's what they love about inpatient physical therapy. It's always something different, so it keeps things exciting. So depending on what you're like, that could be a pro or a con. Another con is just being in the hospital environment. By nature of being in the hospital, you're going to be dealing with bodily fluids. So someone could be having diarrhea, or someone could be vomiting or bleeding everywhere. So all these things are part of your daily job. So if you're uncomfortable with dealing with these type of things, then inpatient physical therapy might not be for you. Now, on to the pro of outpatient physical therapy. So there's more hands-on manual therapy, whether you're into that stuff or not. So you're putting your hands on patients and you're guiding them how to move. You get to do more advanced exercises compared to patients in the hospital. People who come to outpatient settings tend to have higher goals of just returning to playing a sport or being able to walk without pain or being able to garden without pain. So with outpatient PT settings, typically they're a smaller team. So you really get to build close relationships with your coworkers. So it becomes like a family at work. So patients are typically coming to see you week after week for a couple months. So you really get to build a close relationship with your patients, and you get to really see long-term progression and how they improve. And compared to hospitals, it's typically more of a laid-back environment. You'll have the music playing, patients are doing exercises, compared to the hospitals where doctors and nurses are constantly monitoring the patient status and making sure they're stable. And the cons of outpatient physical therapy. Even though it's a more laid-back environment with smaller staffing, it can get really busy. Sometimes it's normal for PTs to see up to 20 patients a day. So with that, there's more documentation that you have to do, possibly even after work. And also because of less staffing, there's probably less of a chance for you to take time off. So if there are 3 or 4 PTs working in a clinic and you want to take some time off, it's a lot harder to do because somebody else will have to take on your caseload and take care of your patients for you. And because of the nature of the business model, sometimes you have to open really early or sometimes you have to close really late, because you want to be available to people to see you before they go to work and after they get out of work. Depending on this clinic you work at, there could be less of a work-life balance. Some days you may have to get in at 6-7 a.m. in the morning, and on other days you may not get out until 8 p.m. So there's less of a consistent schedule. There's less of a consistent 9 to 5. So now that I've talked about the pros and cons of both, I want to share why I prefer outpatient physical therapy. I like to work with more abled bodies, and I like to do more fun and advanced exercises with patients. I like to use clinical reasoning to figure out why somebody may be having pain and to be a guide for patients to getting back to living their best lives without pain. And it's also really nice to work with patients for a prolonged period of time, because you get to really know the patient and kind of build relationships and see them grow. So ultimately it depends. There's no setting that's better or worse. So think about the type of patients that you like to work with. Think about the type of interventions that you like to perform. If you're more into manual and more advanced exercises, probably outpatient settings is for you. And if you're more into the medical stuff and critically ill patients, inpatient setting is probably better for you. And think about your work-life balance. Do you enjoy having a consistent schedule, or does that not matter too much for you? And also keep in mind that this is an overly simplified view of inpatient versus outpatient PT. One of the best things about being in physical therapy is the variety of settings that you can work at. Outside of your typical inpatient and outpatient PT, there's acute rehab, there's wound care, there's schools, there's pediatrics, geriatrics, there's home health, cardiopulmonary disease, there's skilled nursing facility, there's outpatient neuro, there's hospital-based outpatient, there's women's health, and there's also even canine PTs where you're working with dogs. So there's a lot of things that you can do in the PT world. So there's a ton to choose from, but outpatient and inpatient PT are two settings that are pretty common. And if you're choosing between the two, I hope that this video has been helpful. Like always, if you enjoyed this type of content, subscribe and there's more to come.